A surgical procedure is demanding, just not for the patient, but also for their loved ones. Let me tell you a story of a middle-aged man that I treated back in India who had a lump in the neck. He actually underwent some scans and got a biopsy, and that showed cancer. It was my responsibility to explain to him what was going on and that he needed a procedure to be done. He went back home, consulted Dr. Google, and only got more confused because the information that was available is not personalized to a situation. He ended up not knowing what to do, and he said no to the surgical procedure. The cancer spread in due course, and unfortunately, I lost him. I am a cancer surgeon, trained in India and across the globe. I was in the US, Germany, UK, Hungary, and Russia. In my 13 years of surgical practice, I've seen one thing in common, that patients who have to go through a surgery are stressed. This is not just my problem. Surgeons dating back to 6500 BC, where a procedure called trephination was to be done, that's a hole in the skull bone for mental disorders, till today, the era of robotic surgery, surgical patients have stress. Now, why is this? Why is the surgical procedure stressful for the patient and their relatives? This is because medicine is very complex. Somebody can't explain the whole of medicine in 10, 15, 20 minutes. The information available in the internet, as I said before, is vast and not clear. The time available with the doctor is limited. And now, in the corona times, where doctors have to treat serious patients with corona, we have even less time with the surgical patient. All this ends up in many unanswered questions within the patient. This creates stress and anxiety. And sometimes they end up taking the wrong decision, like the one that I just said before. Ideally, a doctor must sit with the patient and go through the consenting process and explaining them what's going on until they actually get it. But this is not happening, isn't it? Let me show you a diagram of a friend of mine who's a surgeon who used this to explain a kidney problem. Well, I can't understand what this is, and imagine the situation of the patient. Not only that, a CT scan like this that I'm showing, which shows a stone in the kidney, is all black and white and very difficult to actually understand. A report of the scan is all medical jargon or medical language. This is designed for the surgeon, not for the patient. Well, this made me think, what can we do now in this situation? 3D visualization is now available in the whole of many different things in the world, right from building a home, buying a kitchen, or constructing a car to buy. We have animations for kids and adults which are of very high quality. Until now, there was something in medicine which is not there, similar to this. So we joined hands with engineers, 3D artists, and researchers. We built a software, actually, that can convert MRI scans, CT scans, ultrasounds into 3D models that can be used to explain the surgical patient their problem. Look at this. The same CT scan that you saw before is now a 3D model where you can see the stones easily. Now, this stone is sitting in the kidney, and this needs a surgery. We thought, what can be done better? We built a software that converts this 3D model into a personalized animation. This animation actually shows you how this stone can be distracted with a laser and removed using a basket and a camera from the kidney. Try explaining this to a patient without this animation. It's very difficult, and they don't really understand what's going on. The moment the patients see this, they get what's going on. We have expanded this system into various other surgical procedures, and we have been using this in the university hospital, and we show that patients are now much more satisfied and confident with their procedure. They actually get to see for themselves what their problem is and how the procedure is going to be performed. This results in better consenting, and they say yes to the surgery. What does this mean for surgery? What does this mean for surgical care? Patients are now more confident. There is now trust in the system. Actually, clinical research and clinical study shows that better understanding among patients results in better healing because they actually know what's going through in their body. And this means that doctors are now empowered with a tool that can actually create effective consenting. This means the surgeons go back home satisfied, and the patients and their relatives are now much more confident. I'm happy to be part of this visual revolution that's happening in medicine. And the time is not far from now when such tools will be available for patients around the world, be it India, Africa, Europe, or America, where they can understand their problem better and get treated in a much better way. Thank you, ladies and gentlemen, for listening to me.